I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are going to talk about what to do and what not to do with a nagging ankle injury. So this seems to be something that's pretty common with people. You roll your ankle. Some people come in for therapy, you get it treated, you roll it again for whatever reason. It just happens. Sometimes it doesn't ever resolve. Sometimes it just seems to have a little bit of an ache or a pain. Last night, literally in bed, I was laying and I just couldn't get it to crack where I needed it to crack. So I'm going to kind of show you a couple things that can help you out in that event that you have either that sprain or just that like I can't even describe like ankle injury sometimes, because literally mine was like, it just wasn't right. It was stiff. I was walking to the bathroom and I felt it stiff. It wasn't necessarily injured. I didn't hurt it. I mean, I've rolled it a couple times on some rocks when I'm running, but nothing really to stop me. So this is kind of one of those things where, you have that ankle that's just not feeling better, or it's a little stiff or a little tight, or you've been to therapy and you've let your exercises go. I hear that a lot, and then you wind up rolling it again, or you're a gymnast and you wind up injuring those ankles that are very precious. So the first thing we're going to talk about is what you should not do is like my pet peeve. And we talk about it a lot in all our videos, but it's the barefoot, okay? Barefoot, flip-flops, things like that, that don't give your foot any support. If you are truly dealing with a nagging ankle injury that doesn't want to go away, wearing a flat shoe, wearing a flip-flop, or wearing no shoes at all is really bad, okay? Your ankles need support. They need that support. A running shoe, a walking shoe is designed to give you the support that you need. Your foot has very intricate structures that respond to the cushion and the type of shoe that you wear. So wearing a flat, like I have on now, yes, don't comment, I know I'm wearing flats, my ankle's totally fine, but they have zero support. Going with flip-flops, going in bare feet, they don't offer anything. So if you really are dealing with an ankle injury where you continuously roll your ankle, or you just have that nagging pain that's not going away, you do need to be very cognizant of the footwear that you wear. You want to make sure that you are in sneakers, either a good walking shoe or a good running shoe, whatever you prefer. Just make sure that you don't spend a lot of time barefoot, even in the house. And I get that a lot. Like, am I supposed to walk around my house? Yes. If you are truly dealing with an injury that is not going away, especially in your foot or your ankle, you need to constantly wear your shoes. Well, the second thing you want to do is you do want to put some ice on it. All right. I know there's people who are out there like, oh, it's a waste of time. If you are dealing with something that hurts, put some ice on it. Okay? It is not a bad thing. All right. What you're going to do is you're going to help decrease some of that inflammation. All right. Don't put heat on it. You want to put some ice on it. Now that's really only if you have pain. Now last night I was stiff. I was not in pain so much, so ice wasn't appropriate. So I'm going to show you exactly what I did to loosen up my ankle. So when you're dealing with an ankle, and this may work some of the time, this is kind of a little bit of a trick. It doesn't always work, but what you can do is, if you actually get down on the floor, there's bones on the outside of your feet, okay? So there's a bone here and there's a bone here. You want to take your thumb, put them on the outside of the bone, and push those two bones backwards as you go forward, okay? You might feel a little bit of pressure on the bones that you're actually pushing backwards on, and that's okay. You don't want to feel pain. That's not okay. You want to do that for maybe 5 minutes. You might get a really good crack like I did last night, which means it opened the joint up and you're totally fine. You don't want to like rail on it. You don't want to have somebody else do it, unless they're a trained professional, because somebody can push a little bit too hard. But that's just kind of a quick and dirty way. Like if you have that stiff ankle and you're walking to the bathroom, you're like, that's not moving right. Kind of get down on one knee. And you can also get down on one knee and just kind of bend forward like this. If you don't feel comfortable pushing back on the bones on the outside of your foot, just do this, okay? Simple range of motion exercises where you're putting some weight and coming forward. You're going to get a good stretch in your calf, and you're also going to get that, that movement of the bones where it needs to go. The final thing that you want to do for ankle injuries or any type of nagging injury in your ankle is balance. And people are always kind of telling me how hereditary balance is, and it's really not. You can train balance, and you should train balance. And it's just like every other part of your body. If you don't train it, you don't have it. No one's going to automatically have really good balance. You need to train it. And a lot of people are remiss in this fact. If you don't train your balance and you run or you do a lot of walking or you're very, very active, you're going to have that nagging ankle injury because it's your muscles and your ligaments in your ankle are going to have to work differently. They're going to have to compensate to figure out how to balance. So you should be able to balance with your eyes open. You should be able to balance with your eyes closed. Doing this while you're brushing your teeth. Doing this while you're washing the dishes. Really good time just to incorporate single leg balance. Make sure you take your vision out of it. Why do you take your vision out of it? Because most of the time that you're running or walking, you're not fixated on a point. So when you stand there and you're staring in the mirror, you're staring at this one point, you're trying to balance, that's not realistic. You want to take your vision out of it. And most people notice that when they close their eyes, it becomes a lot more difficult. You should be able to balance, no problem, eyes closed 30 seconds. Okay? If that becomes easy, throw a pillow underneath your foot. But you have to train your balance. It doesn't come it doesn't come naturally, and it's not hereditary. So if your mom had bad balance, that does not mean you have bad balance. It means you have to train it. It means everybody has to train it. And if you don't train it, you lose it. And that's where, honestly, a lot of these chronic ankle issues come into play. A lot of these chronic ankle sprains come into play because people will sprain the ankle, they'll do some work, maybe even for 6 months, and then they'll let it go. And then all of a sudden, it's like they expect their ankle to stay that way. It's just like running, it's just like anything. If you don't practice it, it's going to go away. So if you don't practice this balance every day, it's going to go away. Once you have an eyes closed and a pillow underneath your foot, and you're doing it for 30 seconds, great. That's all you need to do. It doesn't need to be some huge balance routine. But you need to continue to train balance in order to help any sort of ankle issue that you have going on. If you have any ankle pain and want to schedule a free consultation at our clinic, all you have to do is call 215-997-9898 and we'll get you right in. Thanks and have a good night.